Hi, hello, and welcome back to our channel. This is Geeta Chandra, registered nurse, and you're watching Geeta Chandra Vlogs. In the second last episode, we have discussed with a serious rhythm, that is pulseless VTAC. In this segment, we'll be dealing with another serious rhythm, that is VFib. This is most deadly rhythm that you need to know. So let's watch the video. As you guys already know that the heart has two main pacemakers, the SA node and the AV node. In this case, both will not function properly and the different foci from the ventricles will initiate the electrical impulses. So the heart may quiver, it like shaking. It will not pump properly. The blood is not pumped out from the heart, just like shivering. So this may lead to ventricular fibrillation. This is a serious complication, and you can say it's a terminal rhythm so that there is no cardiac output and there is no oxygen to the tissues. It may lead to terminal death of the patient. So let's see the definition of ventricular fibrillation. A chaotic pattern of electrical activity in the ventricles in which electrical impulses arises from many different foci. This is a randomly fluctuating, completely disorganized rhythm. So let's see the 5-step interpretation of EKG. First one, the rate. It is unknown or indistinguishable. We cannot find a proper rate. The second point is the rhythm. It is chaotic waveform and the rhythm. Third one, P wave, none, because there is no atrial activity, so there is no P wave defined. And the fourth point is PR interval, none. No P wave, so there is no PR interval. And let's see the fifth one, that is the QRS complex. How it will be? There is no QRS complex because there is no ventricular activity. See, we have explained already. Ventricles just quiver. It will not pump blood properly though. So there is no ventricular activity properly. So there is no QRS complex. Causes. First one, cardiac injury. That is coronary artery disease or acute MI or valvular disease can also lead to VFib. Second one is medication toxicity like digitalate toxicity or digoxin toxicity. And the third point is electrical imbalances, especially the low magnesium, sometimes the unsuccessfully treated VTAC or the electrical shock. These three can contribute to ventricular fibrillation. So we should keep these things in mind for the causes. Let's see the signs and symptoms. See, the patient is rushed to the critical care unit. He is collapsed. So let's relate it with the symptoms. C for chest pain. The patient may initially complain with the chest pain, and O for oxygen, that is low SpO2. How we can see the saturation level is decreasing mode. L for lethargy. Initially the patient may complain that he feel a weakness, anxiety. A for anxiety. That is in the initial stage he might have told you, sister, I'm feeling worried about this, I'm uncomfortable. He may complain such kind of things in the initial stage. P for palpitation. This may appear in the very beginning. So we should be very careful in the initial stage. S for shortness of breath. Before ventricular fibrillation, the patient may experience a shortness of breath. Before elevated ventricular rate, the heart rate may be in a varying degree in the beginning stage. D for dizziness or syncope fainting. At the last stage, he may faint. This is a signs and symptom. The management of VFib is a little more vast, so let's see that topic in the next episode. And if you have any suggestion, please mention that in the comment box. And if you're watching this video for the first time, please don't forget to subscribe our channel and press the bell icon for the notifications. We'll present you the more interesting topics in the nursing field. So until then, it's bye from Geeta Chandra.